Huddle call to discuss challenges and solutions for ensuring access to COVID-19 vaccines for older adults and people with disabilities who cannot leave their homes. We are recording today's session so that we can capture all the ideas and experiences shared. Next slide, please. Very quickly, I want to acknowledge that this call series is part of an initiative, a broader initiative to identify and foster adoption of innovative and promising practices on this topic. This work is made possible through the generous support of the John A. Hartford Foundation and the Canby Health Foundation. Next slide. So access to the COVID-19 vaccine for older adults is being prioritized across the country due to vulnerability to more serious illness from the virus among this population. However, for the estimated 15 million older adults and individuals with disabilities who do not leave their homes, access is challenging or impossible. These challenges are not well understood, but government agencies are beginning to attend to them and as the vaccine supply increases. State and local governments across the country, working in partnership with the Aging Network, hospital systems, and other community partners, are turning their attention to this population, and a variety of innovative and practical solutions are emerging. We're all learning together during this critical moment, and these huddle calls are designed to share just-in-time or just-learned information as broadly as possible. In studying this topic, we're seeing some themes emerge. Over the course of this call series, we expect to touch on each of these themes from various perspectives. This graphic depicts these themes as separate ideas. However, in practice, they are interwoven and interdependent. Today, we will hear from Robin Lipson, Deputy Secretary at the Executive Office of Elder Affairs in Massachusetts, who will speak about her agency's experiences in getting the COVID-19 vaccine to those who are homebound and their caregivers, as well as other observations and innovations related to vaccine distribution. And after her remarks, we'll open it up for some questions and discussion. So we can take the slides down. We can all see Robin a little clearer and go ahead and listen. Thank you, Robin. I'll turn it over to you.
Thanks. Can everybody hear me okay?
We can.
All right. It always seems like the worst technology glitches are on Fridays when we have the least reserve to deal with them. I have a couple of slides which I will share at the end because I just think it's nicer if I can see all of you than if we're all looking at slides. But let me talk for a few minutes about the program that we launched officially yesterday for folks who require a vaccine in their home. So, I think some of you, we talked a little bit about this in some of the earlier meetings, but for the state of Massachusetts, we were really trying to deal with two things. We were trying to deal with who should be vaccinated in their home or who might have the need. And once we understand that, how we do that. And we work those two issues in tandem. And let me tell you about the who first, and then I'll talk about the how. So for us, where we landed, and this was after consultation, this was not just an effort out of the state aging agency. We worked very closely with our Medicaid agency and all of our other agencies that serve people who might have similar needs. And where we landed on this was that in-home vaccinations are really for individuals who are not able to leave their home, whether it's to get to a vaccination site or to a regular medical appointment. And, that is very different from any of the definitions of homebound that are currently used either by CMS or ACL. And we felt we had to go to this functional definition because regardless, if you could take two people with the same condition, right? Two people in wheelchairs, one can easily get out to a medical appointment or to a vaccination appointment, and another one cannot. They might need a two-person assist, or they might have a cognitive impairment that complicates their ability to leave the home, even with assistance. So we went to this very, very functional definition, which is really about individuals who have considerable difficulty or who require significant support to leave the home for medical appointments, someone who needs an ambulance or a two-person assist to leave the home, and someone who's just not able to leave under normal circumstances or able to effectively participate in an out-of-home visit under normal circumstances, right? So we really wanted to make allowance, not just for people with physical conditions, but also people who had cognitive limitations, for whom being in a public setting and distanced and with a mask on just wasn't feasible. So that's kind of the definition we landed on. The how that we landed on is that there are really two paths for people. Many people who have looked at this issue believe that local solutions are the best solutions, that local boards of health and local organizations know in many cases who the people are who are homebound. Sometimes they know because of emergency planning purposes. Sometimes they know because the fire department knows that Mrs. Jones is in a fourth floor walk-up and she can't get out herself. There are all kinds of reasons why local authorities know who some of the folks who are homebound are. So what we did in Massachusetts is we have two options, and we gave every municipality a choice. Either their local board of health or their municipality could own the in-home vaccination process end to end, meaning screening people and deploying the vaccine and giving the shots, or they could opt into a statewide program. And we gave them until this week to make that decision. We have 351 municipalities in Massachusetts. About 170 decided that they would take the responsibility to do it themselves, and 100 or 80 or so decided to use the statewide vaccinator. So we have a program now, which is effective next week, where people will be served based on where they live, either by their local board of health and whoever they may partner with, or with our statewide provider, which is Commonwealth Care Alliance. And many of you who have worked in the dual space know that that is an organization that's a managed care organization. They have participated in One Care. They run a senior care options program. They have already been doing in-home vaccines for many of their members across the state. So that's kind of the who and the how. But then the next question is, how do you manage intake from all the multiple sources, right? I have people's daughters emailing me through the state, ask a COVID vaccine question portal. We have ADRCs getting names of people. We have AAAs and aging service access points who are hearing about people. The independent living centers are hearing about people. So how do you kind of organize that? And what we quickly realized is we needed a single statewide portal. And so what we did is we set up a single central intake line. And that intake line is housed at Commonwealth Medicine, which is part of UMass Medical School. They run already several intake lines for us. If any of you are familiar with Mass Options, they already do that work for us. That's kind of the no wrong door, front door for aging and disability information. So we have a central intake line. It is a special number. It is open Monday through Friday from 9 to 5. And the purpose of that line is to take calls from individuals who think they might want or need or be eligible for an in-home vaccine. They do not make appointments for people. They do not execute on the shot. They merely say, Megan, give me some information about you. They establish whether she can get out for routine appointments. If Megan's problem, sorry to pick on you, Megan, but if her problem is that she can get out, but she needs a ride, they connect her with the resource to get that transportation. But if she's truly homebound, they'll figure out what town she lives in. So, oh, you live in Arlington, Massachusetts. That's a town that's doing it through the local board of health. She gets sent to the local board of health. If she were in a town that doesn't do it themselves, they would get sent to CCA, already screened and approved for a vaccine. And then CCA will reach out when they are ready to schedule a shot. Okay, so that's how the central intake line works. Yesterday, which is the first day it was open, we got about 900 calls. And then just to say a word or two about Commonwealth Care Alliance, or CCA in my shorthand, is their responsibility as the statewide homebound vaccine provider is to handle the scheduling and the administration of the in-home vaccinations. People who are registered with the state program will receive a call from them to make an appointment. they will ask all the right questions about, is there someone there to open a door? How will I get in? Because we know, if any of you saw that New York Times article yesterday, I thought they did a great job explaining, you puncture the vial, you have 6 hours to get these doses into people. And if you spend too long at Mrs. Jones's house, that can kind of create a problem, right? So they deal with all those logistics, the scheduling, the geo mapping, understanding how to get in, knowing whether they have to do a 15-minute post-shot monitor or a 30, et cetera, et cetera. They handle all that. They will, by the way, largely be using the J&J formulation for this purpose. So we're hoping most of these are single shots. And what we're telling people when they register and when they're approved is, this is not first come, first serve. This is so complex logistically that people will be grouped geographically. And you may be waiting several weeks to get your appointment, but register, you're approved, we've got you, and you will be scheduled. So they are already starting shots, and many of the local boards of health are already starting shots because they had already factored in these people into some of their allocations, or if they had additional doses left, let's say after a senior housing clinic, they may have said, we have a dozen homebound people and we're going to take care of those now. So this is in launch. We are feeling good about it. We think that we have reached all the advocates and organizations that will send and identify people who need this. And then obviously the governor made an announcement, and so word is out, and it's all over our website. So let me pause there and see if there are questions, and happy to send along the formal announcement and the fact sheet.
Well, first of all, I wish I lived in Massachusetts. Not all the states have taken this on in such an organized way. And because we got started late, I want to make sure that we get right to questions and so forth. I wonder, Robin, if you could, as people are thinking about their questions, and folks, do feel free to put your hand up or put a comment in the chat so we'll know that you have a comment or a question. But I wonder if you could comment a little bit on caregiver vaccination and how that's going to be working in Massachusetts in the context of what you just described.
Yeah, it's a great question. It's something we've talked about a lot. And I would say that we all recognize the real opportunity here to support caregivers and frankly, other people in the household. I mean, sometimes there's an opportunity in a multi-generational household to really vaccinate, many people who might otherwise be reluctant. I think right now it's a question of supply. So we have not made that initial commitment to cover all caregivers or other people in the home. I think we are open to it, but it is really dependent on vaccine supply and us having a sight line on consistency of supply. So I think that is still an open issue for us. I am hoping that we will learn a lot about how many people who need an in-home vaccine have a caregiver who is not already vaccinated. So in many cases, if people have paid caregivers in the home, in Massachusetts, those folks were eligible in phase 1 in our first wave, and many of those in-home providers are vaccinated. If you're a caregiver who's not paid, if you're a family member, you're functionally homebound because you're never leaving because the person you take care of doesn't leave. So I hope that we can get a handle on that. And I hope that the supply leads us to a place where we can accommodate those folks.
Thank you. We have a question from Laura O'Brien. Laura, you want to unmute and ask?
There we go. Yes, I was just doing a query as to those individuals that are identified to qualify for the in-home vaccine. Do they have an option to any other vaccine other than J&J?
So that's a great question, and that really depends largely on what's allocated into the state. When we worked with Commonwealth Care Alliance, it was quite evident to us that this would be a much more manageable task if we were using the single dose formulation. I'm sure there will be situations where either because of allergies and some other medical issue that may not be appropriate for some folks. So I'm sure we will try and find solutions if that happens. If people are getting vaccinated by their local boards of health, they may be working through some Pfizer or Moderna doses that they have. So it's a bit of a hodgepodge because we've had to work with the supply that's available and that's coming in. And I think you all know, everybody's in a very similar situation in terms of, the challenges around quantity and predictability. And this may take us several months, and I would assume that the supply will change in that several month period.
Thank you.
Scott, go ahead. Scott Bain has a question.
Yes, hi there. Scott Bain from the John A. Hartford Foundation. Rob, hi there. Okay, thank you so much for your presentation and congratulations on launching this program. It's very impressive. My question is just, how long a lag time is there between someone calling the central line and somebody getting back to them with the appointment details?
Well, I think that will vary again on where they are and what the volume is. They will be told in that first call whether or not they can expect to be connected for an in-home appointment. And if they're not eligible, they will be sent to other resources. Sometimes people need help to make an appointment, so we send them to a call center, or they might need transportation help. So we deal with all that, or they might just find out that they could bring someone with them to a vaccination center and that would be okay. And in Massachusetts, since everyone will be eligible in a few weeks, it will be no problem for people to get vaccinated in tandem. But I think if you are, so right away if you're eligible, and then it may be a matter of a few weeks before there are enough people in name that town or within close proximity to that town that you can pierce the vial and administer all the doses effectively. And so that's the challenge in the scheduling. So I would say it's highly variable.
Thank you.
You're welcome.
We have, hold on, lost my screen. Sorry about that. I lost my screen. We have a question from Serena Chow, who's actually the geriatrics division chief at Cambridge Health Alliance. I suspect you know each other. Serena, you want to jump on and ask your question?
Yes. Hey, I'm just so excited that the state actually has put together this plan. So I heard Secretary Mary Lou Sutters, our Secretary of Health and Human Services, mention that there are about 25,000 residents in Massachusetts that actually meet that definition you shared earlier. So I'm just curious how the state is planning to pay for all those vaccinators, because I'm using my experience with our vaccination of our house calls patients. And we only had, and a few others in our Cambridge Health Alliance universe, there were 82 patients that we ended up fully vaccinating in the last 4 weeks. But it was such a process because of the tight regulations around handling. Like what we had to do was have 3 or 4 vaccinators out in the field simultaneously, and a courier would actually drive a pre-filled syringe in a cooler bag from our CHA mass vaccination site directly to us, hand the vaccine to us, and then we would give the shot. And then an hour and a half later, we'd move on to the next patient's home. So 4 vaccinators could potentially vaccinate 20 people in one day. So I'm just thinking, how is the state, how are you thinking about recruiting the vaccinators and paying for them? Because
that's a great question. And that is exactly emblematic of why this is so complicated. It was a very heavy lift to figure this out for all the reasons that you just laid out. So how we deal with that is, first of all, many thanks to the many providers who have actually already done this for their homebound patients. And I know that there are people at Cambridge Health Alliance, at Mass General Brigham, at Boston Medical Center, some of the VNAs that have done this. And I think they will continue to do that. And that's excellent. Some of the managed care organizations are doing that. So we expect that will continue as they are able. But the real reason to have a statewide program is to deal with the scale and some of the efficacy issues that you just talked about. So part of what you need to do is you need to have one provider for a given area so that they can scale the visits, do them with us in a certain time frame. And you might I didn't think to do this today, but we could have somebody from CCA actually talk about their model of how they're scheduling and what the what human resources are go into the team and how they effectively manage that, because that's a big part of the secret sauce of having a vaccinator who knows how to do this. And again, in local cities and towns, they know the neighborhoods. They know that there are 4 people in this building. They can get them all in the same afternoon. So that's a big part of what will make this work. You can't just do this in 1s and 2s and have it be effective. And the fact that you did 82 people is both wonderful and extraordinary. And I know it's a huge lift. And then in terms of payment, you know, we do pay, I think, rather well in Massachusetts. We're paying about twice the Medicare rate for vaccine administration. So in all the complaints that I hear, I have not heard one complaint that people are losing money on this or that there's a financial concern. So I'm feeling like we're on pretty solid ground on that.
Robin, I know you said at the beginning that you might want to share some slides. And so this might be the right time. I think we've made you a co-host, so you should be able to do that.
Okay. Well, actually, I think it would just be better if I sent them all to folks. Is there a way for me to do that? Because it's everything I just talked about, but I think then you'd have it in writing.
Of course.
Okay.
So we do send the slides out. So what you can do is share them either with Megan or with me, and we'll get them embedded into the slide deck before we send them out.
Okay. So I will do that, and I'll also send you the announcement. And then obviously we're available at any point to answer questions that people have. And I want to stress that this is really a full state effort. I was one of many people on the team, but it is by no means just for old people. It is for folks who are truly not able to get out.
Well, I'm gonna do a little bit of a wrap up here. We have a lot going on. I want to thank you, Robin, so much for joining us for this. It's with wonderful information and conversation today. And we'll be sharing the slides and the recording following the event. Now for April, we have a new way to register and for these huddle calls, which will continue through April. And they will continue to be on Wednesdays and Fridays on topics related to COVID vaccine for the homebound. But there is a new way to register, which I have now just pasted into the chat. And oops, I think I pasted it. Yes, there it is. Okay. And but just a note that there will not be a huddle call on Wednesday, the 31st, because on that day, at that time, TIFA is hosting a webinar on the topic of vaccinating those who are homebound. And we hope you will all join us for that. It will cover a much broader range of topics. And I am putting the registration link for the webinar also in the chat in case anyone has not heard about that one. Otherwise, the huddles will resume on April the 2nd. And we look forward to having you join us and to please spread the word. Thank you, everyone. And again, Robin, for joining us. And thanks for putting up with our technical issues today. Take care, everyone. Have a great weekend.
Thank you. Congrats, Robin, for everything that you're doing up there.
Oh,
thanks so much.
Excellent. Excellent. Yeah.